weekly test totals, you may have seen that they fall in the past 2 weeks to their lowest weekly levels since the end of October. Positivity percentages are their highest yet. Is it possible, is it even likely maybe that more people should be getting tested right now than seem to have been getting tested?
Well, we know we have an adequate testing rate when the testing positivity drops down to about 5%. So absolutely, we're not getting quite enough testing out there. The good thing is there's many, many more avenues for this testing to be performed. So not necessarily public health, but looking in your private doctor's offices, looking at the rapid test, um, looking at urgent cares and all that. They do have the ability to do immediate testing. And so the pressure on public health, I think, is decreasing on that war front. And we're having to make a switch to the new front, which is vaccination, which is the definitive answer for this disease.
If fewer tests are being conducted when community spread remains high, even if we're talking about a difference between 19 or 20% positivity and 16,000 tests a week and 27% positivity and only 9,000 tests a week, are there any public health disadvantages in terms of mitigation, quarantining, contact tracing when there is less testing taking place and therefore probably a few more people walking around with it that don't know?
Well, that is absolutely a public health concern. Is we want the first principle is disease detection. We have to know where the disease is to figure it out. The second thing is isolating and quarantining those who may be potentially either have the disease or come down with the disease. And that's the principle of isolation and quarantine. So yes, we're concerned about that. Um, uh, and Testing availability has just become so much greater. So it's a matter of where do you get that test now and what is that availability? Whereas in the beginning, we didn't even have the ability to test except on an extremely limited basis. And the types of tests that have come out have also made this a lot more convenient and easier, looking at the antigen test and the PCR test.
Is it possible, community spread officially was about 119 per 100,000. We do 14 and 7-day, but I'll just go 14-day. Back on the 20th or 19th of December, it was 119 per 100,000, 7-county area. And, now it's 82 per 100,000. Is it possible that in reality, community spread is as high or higher than it was a few weeks ago because of the lower number of tests being performed?
That can be a good assumption, but sometimes we also need to look at other measures to look at the adequacy of disease control, and that's looking at our number of hospitalizations and number of deaths. And in our region, we continue to have a high rate of number of deaths, and our hospitalization rate remains elevated. So just because we don't necessarily have the numbers on the testing side, it tells us, the disease tells us with the severity of the disease, we still have high rates of community transmission.
I see the website for Sullivan County. It's only offered right now at the health department in Blunteville. And you talked a little bit about this already, this pivot. Has your testing capacity been curtailed? And if so, by how much, because of you needing to focus on vaccinations?
Well, we have stopped doing testing in the Kingsport side because we needed those personnel to get the vaccine out to those who are at most risk. And we do know the vaccine is life-saving and has a 95% efficacy rate at disease reduction. So for public health, the answer is getting out vaccine to the most vulnerable groups. The other is we were able to do that because we have the widespread testing capability now in many, many other sectors of the medical community.
So in a perfect world, whether it were people availing themselves of this now broad array of other options to get tested, or the health departments having armies of people so you could do both. Is a both and situation probably better for public health? Testing rates maybe back up considering the positivity rate right now, and of course you guys being able to focus a lot on vaccinations continuing.
Well, in a perfect world, yes, we need both. And that's the reason we still have to practice our safety measures, even with vaccines starting to come out. We've got to continue to socially distance. We've got to maintain masking. We've got to keep our hands washed. Um, and with the schools coming back into session, we've got an increased risk of further transmission and increased disease. But we know what we have to do to control it. One is detect it and test for it. The second is get those in isolation and quarantine. And the real answer for long-term getting out of this mess is going to be getting vaccine out. And we're really being challenged by our vaccine supply. It is just so limited. And so that's why we're really trying to focus on those who are 75 and up, getting it into our long-term care facilities, protecting our healthcare workers so that they can continue to care for those who are sick. Um, and that's why we have the phases that we're currently working through. In a perfect world, if I had lots of help in all areas, we could do it all. But this is a team response, and we have to rely on our medical professionals. In the community, we rely with Ballad, who's been a wonderful partner working with us, both in the testing, caring for the patients. We work closely with the schools and are working with all of our partners, to encourage testing. And we've got multiple modalities for testing that's available now. So we've had to make the shift to get more vaccine out than, and we still have testing available from 9 to 3 here at the Blumpville side.
By the way, I think that my 14-day average daily hand washings has been far higher since March than ever before in my life. I probably should have washed my hands more before 2020 than I did, but at least I'm doing it now.
I think you're going to see a change in social interactions for some time now. And the way that we deliver health care is we're going to have to learn from these lessons. If we've got sick people in our waiting room, we've got to separate them. We really need to keep masking them, and we need to protect our healthcare workers. We go through this every year with flu, but the amazing thing is, and knock on wood talking about flu, uh, the amazing thing is this year we've not seen much flu, and I think it's because of a lot of the safety measures we've implemented, and it's only common sense.
Yeah.
Public Health 101, once again.
Yeah. So your recommendation to the public right now in terms of Joe Sixpack, who's wondering based on various factors, whether it be symptoms, possible exposure, et cetera, quote unquote, should I get a test? What's your recommendation?
Well, the first thing to do is for anyone who is feeling any type of symptoms, they should first isolate. Let's prevent the spread. And then we ask the question, well, what is it? And at that point is where you should consider the test. So anybody with fever, chills, fatigue, malaise, sore throat, cough, cold, congestion, and even nausea, vomiting, and diarrhea needs to think about, well, do I need to get tested? Number two, who have I been around and have they gotten sick? If they've been sick and you know that you've got a positive exposure, there is a very good chance that you could have COVID-19 and not have a severe case, but we don't want you transmitting it to other people. So once again, the first thing you do is isolate. Then you test and figure out what you've got. And then we want people to return either once they've completed their isolation and quarantine. And if it's not COVID, we want you to stay away from everyone until you're well for 24 hours.
Thanks for that. So bottom line, and I mean, you've sort of answered it at various points, is the fallback in testing totals a concern to you in any way, shape, or form right now?
Well, it is a concern, but we recognize in public health with the limited resources we've got that the true answer lies in getting this vaccine out and to the most vulnerable first. And that's our critical answer. And as in any war effort, battling on 3 different fronts, we have to triage our resources to get the most bang for our buck.